We're going to talk today about high blood pressure and how it affects our health, and the things that we can do to start taking care of this health problem. This is part of a series from Sierra Providence Health Network, and I'm very honored to have been invited by them to do this presentation. Before I came into private practice and moved to El Paso, I was an academic cardiologist at the University of Arkansas for Medical Sciences. I did this for 6 or 7 years, and I used to do a lot of lectures. I miss that interaction, and thank you for coming here, and enjoy your lunch while we go through these slides. I'm going to try to keep it nice and simple. So high blood pressure is the term that, or let me put it the other way, hypertension is the medical term that we use to describe high blood pressure. It is a very prevalent healthcare problem. It affects millions of Americans. I don't know how many people in this room has high blood pressure, was told that the blood pressure might be a little high. It is a very important concern. Millions of dollars are spent in taking care of this problem. It causes a lot of complications over time. It's a disease that was labeled the silent killer when it was first given attention many years ago, when there was actually no antihypertensive treatment, and people were coming up with the first sign of having high blood pressure being a stroke or a heart attack. Nowadays, we have come up with tighter ways to take care of this problem, and we're trying to curb a little bit the development of these complications. So why should we care about high blood pressure? And what the high blood pressure does, it increases the heart workload and makes the heart stiffer. So among other things, your heart has to work harder in order to push the blood against a higher pressure. I tell my patients that it's just like your biceps. If you're doing this movement 60, 80 times a minute, your biceps will get to a certain size. But if you put 20 pounds, it'll get bigger. And if you put 60, it'll get even larger. So it is the same mechanism. The heart is a muscle, and it does react to the strain of the blood pressure, which is maintained by the blood vessels. The clenched vessels make the heart have to work harder in order to empty. So a stiff heart is a problem over time because it's a heart that does not dissipate the pressure. It can lead to shortness of breath because that pressure gets transmitted back to the lungs, arrhythmias, and other complications. High blood pressure, hypertension, increases your risk of having a stroke because the resistance of the blood vessels in the brain sometimes is overcome by the amount of pressure, and vessels may burst. And you can have bleeding in the brain, or not only a bleeding, you can, develop a blood clot, which are more common in high blood pressure patients. That may block the artery that controls your handwriting or your speech or your memory. And it creates a lot of consequences to the individual who develops one of these problems. So the ultimate goal is to prevent these complications. Another common complication of high blood pressure is heart attack. Patients with high blood pressure are more likely to have a myocardial infarction, commonly known as a heart attack, where one of the vessels in the heart gets blocked, and we do not have blood flow going to the heart, and then that part of the heart essentially dies. And in the process, provided you survive the event, you're going to be left with what is called heart failure, a heart that is not able to pump as well. It also affects the kidneys. That's another target organ for high blood pressure, making them less efficient to filter the blood. And it becomes a cycle in which kidney failure leads to high blood pressure, and high blood pressure leads to kidney failure. So a very big concern. Congestive heart failure, the only form of heart disease that is continued to increase in prevalence. It's many a time a consequence of chronic high blood pressure. Patients having, just like that heart I was telling you, is pumping against 60 or 80 millimeters of mercury higher than it should be, it gets to a point that it wears out and it balloons and it becomes weak. That's one form of heart failure. You can have heart failure without having a weak heart, just by having a stiff heart, as with the mechanism I was trying to explain of a heart that doesn't dissipate the blood pressure. Basically, we need to talk about knowing our numbers, or what is the blood pressure, the blood sugar, and the cholesterol numbers that we need to know. I think you're going to have separate lectures for cholesterol and blood sugar, but we really need to know our good and bad cholesterol. Is the rate, not just the total cholesterol level, but how much of it is the kind of cholesterol that is sticky and it goes and adheres to the vessel wall and blocks it, versus the kind of cholesterol that removes, that is repellent to the vessel wall and brings the cholesterol back to the liver to be eliminated. But really, being high blood pressure the focus of this presentation, we'll talk a little bit about what are the numbers that we need to know regarding hypertension. Blood pressure is a combination of two numbers. It's expressed as a fraction. The top number of the on the equation is the systolic pressure. For example, 120/80. The first number, the higher number, is called systolic blood pressure. It is the result of the force of the heart emptying. Is the amount of pressure that we can record in our arm, where the blood is traveling at a certain force. That force is generated by the squeeze of the heart and maintained by the vessels that had a certain tone of, they're either too relaxed or too clenched. And that number, the higher number, is called systolic blood pressure. It's usually the number that we talk the most, and after a certain age is really the number that really matters the most. But the diastolic number, that 80 that you see in that equation, it's also important. That's the number of the blood pressure when the heart is relaxed. And that's the number that is almost entirely maintained by the tone of the blood vessels. How clenched, how tight our blood vessels are is what keeps that number, because heart's already relaxing. So a normal blood pressure should be 120/80. The units of blood pressure are called millimeters of mercury, and that's what we see on our scales, although we have digital monitors now for most of our readings. It was first measured and how much the blood pressure can push the column of mercury on a meter. And they have come up with these numbers to remember. And I think when I see patients in the office, it becomes very useful for them to learn at least the last number, 140/90. That's being the number at which blood pressure medication is usually recommended. That's the number below which you really want to be. 140 for the systolic number, 90 for the diastolic. Either one of them being high is enough to be a concern. So you can have 150/80, that's already high blood pressure. Or you can have 130/95, and that's also high blood pressure. Now, we have societies that are usually a panel of experts nationwide and sometimes internationally that determine what is going to be the definition of a disease. And they came up with this number, this category of prehypertension, where your numbers are not yet bad enough to be called high blood pressure, but are heading towards it. And I don't like the term prehypertension personally. Some people call it high normal. There's different ways to say it, but it's still normal to have pressures, 139/89. It's borderline, but if you're 130/80 or 85, you're still having more or less numbers that are considered within the normal range. Now, if you have diabetes, if you have kidney failure, you want to be a little bit more strict. But I think sometimes we get too overzealous on how much we want to get these numbers down. The other thing that drives people crazy sometimes, patients, is the fact that blood pressure is not one number and stays the same level throughout the day. It varies throughout your day, and it could be 140/90 when you're out on the street trying to get to your appointment, or being late for work and there's a traffic jam, or it could be higher if you get into an argument with somebody, but it could be much lower when you're at home relaxed. So the fluctuation in blood pressure is important. Now, the question of how do you get high blood pressure, nobody knows exactly why blood pressure develops, although there's plenty of studies. It is a tendency of the physiology of the body to manage at a higher number because of the way our body handles body fluids and sodium, which is really what determines the pressure of the blood. But this is more than a scientific interpretation of why we have blood pressure. This is more about why we go into the tendency of having blood pressure. And one of the risk factors is obesity, big epidemic of obesity in the United States. Salt intake. The average American diet has probably 5 or 10 times the recommended daily allowance for sodium. We'll talk a little bit about that when we go to the next few slides. Drinking too much alcohol has also is a risk factor, but moderate alcohol intake, when you can keep it to 1, maybe 2 drinks per day, particularly if this is red wine or not hard liquor, but a light beer or red wine, that has a salutary effect on blood pressure. Once you start getting into the 3rd, 4th, the 6-pack, the case, that's when you get into not only risk for high blood pressure, but other whole host of medical problems. Not exercising enough. We're a sedentary society. Here in Texas, distances are so long, so large that it's difficult to walk into any place. And then if it's not that, the weather is usually too hot or too cold or too windy. So we really cannot work to our jobs. We live far away in the suburbs, so we need to commute. So we need to find other ways to exercise. And most people will have to go around the block or get a treadmill or do something, but we really don't exercise enough in this country. Smoking, big problem too, not just for high blood pressure, but lung disease and in general vascular disease. And stress, a very underestimated risk factor for hypertension, and something that needs to be addressed on a case-by-case basis by ourselves, doing a lot of examination of our schedules and see what we can come up to reduce our level of stress. So how can we prevent high blood pressure? And we talk about a 3-step approach: keeping a healthy weight, getting plenty of exercise, and believe it or not, sleep also. A good overnight sleep decreases your risk of hypertension over time. Blood pressure drops during sleep because we're more relaxed. If we don't have enough sleep, we don't allow it, but it goes back to the stress level factor. We can find 10 other steps that we can take, and we were going to talk about that, decreasing salt intake in general. But just for there's so many health problems that could be prevented just by eating less and walking more. That's as simple as that. But we're going to get a little bit more in detail about these recommendations. So what it says here is here's how to eat and get your weight to a lower weight. A few recommendations. Let me go back. You gotta limit the portions. As you could see today, you're having a meal that meets the recommendations for the DASH diet, and we're going to talk a little bit about that. The portions are small. We really have increased the size of the portions here in America to 3 or 4 times what they were in the 60s or the 50s. And if you go back and look at videos and or old movies, or you go into YouTube and just go back and see video clips. Or everybody was thin back